Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is June 19, 2025. This video is on an article titled Heart Failure with Improved Ejection Fraction, Definitions, Epidemiology, and Management. It is free access and is published in the most recent issue of JACC, or Journal of the American College of Cardiology. What is heart failure with improved ejection fraction? It refers to patients with previously reduced left ventricular ejection fraction, less than 40%, that improves by at least 10 percentage points to greater than 40%, typically after a guideline-directed medical therapy. How common is heart failure with improved ejection fraction among heart failure patients? The prevalence is 23%. The range is from 9 to 57%. 60% lower risk of cardiovascular death versus persistent heart failure with reduced ejection fraction. Up to 50% relapse within 3.5 years. Does improvements in left ventricular ejection fraction mean full recovery? No. Despite improved left ventricular ejection fraction, patients remain at elevated risk for relapse and adverse outcomes. What are the outcomes of heart failure with improved ejection fraction when compared to heart failure with reduced ejection fraction and heart failure with preserved ejection fraction? These patients have better outcomes than those with persistent heart failure with reduced ejection fraction, and often better than heart failure with preserved ejection fraction, including lower mortality and hospitalization rates. What are the key predictors of reverse remodeling? Younger age, female gender, non-ischemic cardiomyopathy, short disease duration, higher systolic blood pressures, lower biomarkers, absence of ICD, fewer comorbidities, and full GDMT. What imaging techniques help assess heart failure with improved ejection fraction? Echocardiography with the global longitudinal strain and LA strain, and cardiac magnetic resonance (CMR), reporting fibrosis, T1 mapping, and ECV. And these are valuable for predicting left ventricular ejection fraction trajectory and risk stratification. Which biomarkers predict reverse remodeling? NT-proBNP, troponin T, soluble ST2, galectin-3, and big endothelin-1 help to assess myocardial recovery and risk relapse. In our practice, NT-proBNP is the one we use. What is the role of GDMT in heart failure with improved ejection fraction? GDMT remains essential even after improvement of left ventricular ejection fraction. Withdrawal often leads to relapse. SGLT2 inhibitors and finerenone have shown added benefit. Is GDMT de-escalation ever safe? Cautious tapering may be considered in select patients with reversible causes and stable recovery, but remains experimental. When should an ICD generator replacement be reconsidered in those with heart failure with improved ejection fraction? The replacement should consider fibrosis on cardiac CMR, biomarker levels, arrhythmic history, and not solely on improvements in left ventricular ejection fraction. What ongoing trials are exploring the management of heart failure with improved ejection fraction? PROSPER heart failure, VEAN heart failure, with heart failure, and trials on GDMT tapering are evaluating therapeutic strategies and de-escalation safety. Is genetic testing relevant in heart failure with improved ejection fraction? Yes, especially in idiopathic or familial cases. High-risk mutations, example LMNA and FLNC, warrant prolonged GDMT and ICD consideration. in my own practice, I see a lot of cardio-oncology patients. So the ejection fraction often goes down from 60 to 45%, and quite often with stopping cardiotoxic therapy and GDMT, there is recovery of left ventricular ejection fraction. But I tend to continue the GDMT indefinitely until we have more data. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.